I'm Joel Cohen. I practice in metropolitan Denver, Colorado, and we have a dermatology office that really focuses on the full spectrum of dermatology: medical, surgical, and aesthetic dermatology. So I'm very involved with resident teaching and resident education, and I've been really fortunate to have some wonderful people spend time and rotate through the office through different preceptorship programs such as the ASDS preceptorship program and some of the international programs as well. And one of the things that I'm asked frequently is, how do we incorporate procedures and products in our practice? And I can tell you that there are a lot of technologies that we look at that just don't seem to fit into what we're looking to embrace in terms of data, in terms of efficacy and safety and experience. In being involved with resident education and some of those preceptorship programs, it's really an opportunity to analyze some of the decisions that we make in terms of how we bring new products, new procedures, or new surgical endeavors into our practice. And over the years, we've really embraced some of the technologies that have a lot of data and a lot of studies and years of clinical experience. So I think in our practice, Vbeam is something that fits into that mold very well. We have 4 doctors in our office, and we see a lot of patients who have rosacea, and that machine is being used constantly for rosacea patients, erythematotelangiectatic rosacea patients. 40% of my practice is Mohs surgery and creating surgical scars and removing skin cancer. And if somebody has a red or thickened scar, Vbeam has worked really well for those patients. And then for the folks out there from an aesthetic perspective, treating the poikiloderma of Savant that they have on their neck, Vbeam has worked very well for our practice. We see people who may have port wine stains, we see people who have big vessels on the side of their nose, or we see people with venous lake. And Vbeam has been really a high-functioning piece of equipment in our office and very effective for those conditions as well. So for people who've focused traditionally on a more medical dermatology practice over the years, I think having a product like Vbeam and incorporate that into the practice for people who have rosacea, getting comfortable with the settings through maybe treatment of scars and treating some of that neovascular blush and the little vessels that we see coming into scars is a really great way to learn how to use the modality and to see a lot of happy patients. Really, in those types of conditions, I think that there's a whole spectrum of dermatologic, aesthetic, and medical issues where you can incorporate Vbeam. And having it first for people who may want to help improve the appearance of red scars, help improve the appearance of vessels on their face, or overall treat large areas like poikiloderma of Savant, it can be very effective. Just as Vbeam has been very effective and successful in our practice, CORE has been as well. So CORE is a fractional CO2 device, not only for the traditional uses of fractional ablative photorejuvenation, but we're also treating a lot of scars. CORE has been a wonderful addition to our practice in terms of treatment of fine lines and wrinkles and seeing some improvement in some laxity, but also that overall global photorejuvenation of the face and just extending over the neckline. We've seen very nice improvement from many patients who've been happy with their fractional CO2 CORE treatment. The way I use CORE in our practice is doing full face fractional ablative CO2. Secondly, there are areas where people have more specific fine lines and wrinkles that could be harder to treat, such as on the upper lip or around the eye, and using it in a deeper setting, using more density, and in some cases incorporating that fully ablative mode in those specific areas can be very helpful. And again, the treatment medically of actinic cheilitis of the lip is a great way to learn how to use this laser and really to understand some of the endpoints that you're looking for in treatment of that condition. The tip itself is something that you can change the shape of the spot size. So when you get into certain areas that you want to focus on, that maybe you want to change the spot size. A good example is the lower eyelid or on the upper lip as you treat etched in lines. You can really tailor that to the shape and the contour of the area that you're working with. CORE has been very effective for treating scars. With 1 in 5 Americans having a skin cancer, we're seeing so many people, even at a younger age, get skin cancer. And people are becoming very interested in treating their scars. So really, we can't make scars go away. I always tell patients I'm hoping to minimize the scar. So when we do surgery, we tell them about some of the newer scar studies that have been done in terms of early intervention scar therapy, and then we give them that opportunity to incorporate the Vbeam, and we'll try to thin that area out. In terms of scars from a texture perspective, if we see a line, if we see something that really just needs to be blended out, I think the core has worked really well to treat over that area. And there's some people, you know, that they're fair complected and that they do have type 1 rosacea and their scar is going to be red, and that's a patient that sometimes we'll actually treat with both the Vbeam and the core on the same day, combining the benefits of both of those procedures on the same day, same treatment session, same downtime for the procedure, and that's worked well in our practice. Many of the skin cancers that we see are affecting the nose, and reconstructing the nose has its own set of issues because the quality of the skin in the nose tends to have a lot of pore structures. It tends to be in an area, as the central face is, where people get a lot of flushing and a lot of redness. So being able to incorporate both modalities, the Vbeam for the facial redness and flushing, and being able to hit really some of the textural irregularities with the fractional CO2 core has been very effective. In combination, we use Vbeam and core for surgical scars on the nose. With skin cancer scars, we're seeing is that intervening earlier is leading to better results in terms of remodeling. So I think that we're seeing an evolution in the way that we actually treat scars. We're seeing younger people who are aware of the modalities and the technologies that we have that don't really want to have a prominent scar for a long period of time. They want to try to jump in there earlier, sooner rather than later, and the data is starting to support this as being a more effective time to try to remodel scars.